conference features two prolific researchers focused on substance use and recovery in Latinx communities, both in the US and Mexico. Dr. Alvarado Valdez is the Cleophas and Victor Ramirez Professor of Practice, Policy, Research, and Advocacy for the Latino population at the USC Suzanne Dworak-Peck School of Social Work, and primarily focuses on the relationship between substance abuse, violence, and health issues among high-risk groups such as youth, prison gang members, sex workers, and aging drug users. Dr. Alice Cepeda is an assistant professor at the USC Suzanne Dworak-Peck School of Social Work, and her work focuses on the social epidemiology of drug use and the related health risks, behaviors that disproportionately affect urban Mexican origin minority populations, including violence, HIV infection risks, and mental health conditions. Please welcome Dr. Valdez and Dr. Cepeda.
Thank you for that very kind introduction. What we're going to do is a little bit different than the previous presentations. We'd like to introduce you to our program of research and how we frame our work and how we framed our work for the last few years. Primarily, as Nicole mentioned, our work has focused primarily on the socio-epidemiology of substance use and related health disparities among Latinos. We've worked here in the United States among Latino populations, and for the last 10 years or so, we have also been working in Mexico. We have currently two studies. One study is funded by the National Institute of Minority Health Disparities, and it's an immigration study that's looking at a population of immigrants recently immigrated to LA in particular from Mexico, and a comparison group of immigrants that have recently deported back to Mexico and specifically into Mexico City. So this study focuses on, of course, a lot of the health disparities that result from this immigration process, but also on substance use. Our other study focuses is a follow-up study on female gang-associated persons who we first interviewed when they were 16 or 17 years old, and we've been able to follow up this population. Now they're approximately 35, 37 years old, also looking at issues related to health disparities and substance use. Our research demonstrates that drug dependency is largely related to health disparities and the impact of larger macro social factors on this population. And, you know, our work goes beyond kind of the person-centered focus that I think some of the other people have presented. For example, we think it's very important to recognize the impact that the war of drugs has had on underserved communities, especially racial and ethnic populations in the United States. This war on drugs, has resulted in very serious collateral consequences as implemented by the criminal justice system. In particular, a lot of our focus has been on the consequences of incarceration on individuals, their families, and their communities. And we argue that this war on drugs is largely responsible for kind of the disparities that exist and the consequences of substance use in these communities, and define it as a policy failure. So with those kinds of introduction remarks, I'll pass it on to my colleague, Dr. Cepeda.
Thank you, Avelardo. So I'm Alice Cepeda, and Avelardo and I have been working together for over 20 years on these issues particularly as has been mentioned previously, among Latino populations. One of the things that's very unique, I think, to the work that we both do with our research teams is that the nature of our methodology and the nature of the populations that we work with. Specifically, our methodological approach tends to focus more on recruiting populations who are what we call hidden populations, vulnerable. They're not easily accessible. These are not populations of substance users who are currently in treatment or based out of community organizations. The work we do and the teams we have worked with focus more on recruiting populations who are out of treatment, who do not necessarily seek out and are not ready for any kind of services or treatment. So we do a lot of street-based recruitment. This means that we actually put our tennis shoes on and our jeans and we go out and recruit men and women in some of the hardest to reach geographic contexts, both in the US and in Mexico. So for instance, currently in our NIMHD research project, we are recruiting recently arrived immigrants in Los Angeles and recently returned either voluntarily or forced through deportations in Mexico City. And so this really requires a type of methodology that gets at identifying populations that normally go underrepresented in larger surveys across the US and in Mexico. This really gives us, I think, a lot of insight into kind of the nature of the epidemiological factors that are really kind of the basis to understand how to develop and create culturally tailored services, treatment, prevention for this population. So on that note, I think one of the things that we have really learned from a lot of our research is the fact that access to quality health care, treatment, and or any kind of recovery services for this population is typically not accessible for the populations that we work with. They're very inaccessible for many different reasons, and we can talk about that in the Q&A. So one of the things that we have really started to focus on within the last 5-6 years is focusing on kind of how do we provide access to healthcare and treatment that are what we would call kind of more low barrier services, and this includes harm reduction. I think this has in the past, it's been kind of a taboo term to use, but we're seeing it now more and more as something that is feasible and that we really need to start putting our money into understanding how effective evidence-based harm reduction services are. And this could include anything from syringe exchange programs to providing naloxone. More recently with the fentanyl epidemic, we are seeing now colleagues and research starting to focus on fentanyl test strips. So I think one of the most important things about the work that social workers and the work that public health researchers need to begin to address is to see drug dependence as a public health issue that may only be addressed for these vulnerable populations by incorporating more evidence-based harm reduction services. I want to bring to your attention, if you have not seen it, that recently the Biden-Harris team put out drug policy priorities, and enhancing evidence-based harm reduction services is one of the most important priorities for them among, a whole slew of them. So
Yeah, and I think that just to add to that is it's very difficult to deal with drug dependency without taking into consideration the context of where the drug use is occurring in the populations it's occurring, and to focus primarily on the individual, I think. Was not necessarily the way that we should be thinking about this. And in particular for vulnerable populations, which drug users tend to get highly demonized and are not provided and giving access to the kinds of services they need, and the larger context of where this actually occurs.
And I think, to start kind of wrapping it up, we have said this throughout the last couple of minutes, but I think we are moving towards this issue of racial equity and drug policy. The research that we do with Latino populations, and these are primarily Mexican origin populations, we kind of see the systemic inequities that just kind of perpetrate the disparities, and we're talking about disparities in terms of social, physical health that have been consistently evidenced in the last 3 to 4 decades, and so we, as I think, as public health researchers, we need to start focusing on how we actually operationalize that health equity in terms of drug policies and in terms of access to services. So I think with that, we will close, and we are more than happy to talk more in depth about the specific research projects that we currently are undertaking. So I think we can probably begin some of the Q&A, and we have a question in regards to health disparities between people immigrating to Los Angeles versus those being deported. And yeah, we could definitely talk a little bit about that.
Well, one of the big issues of deportation now, and many of you are probably aware that there's a huge number of people that are being deported. Just looking at the Mexican origin populations that we're seeing, large numbers of people who came to the United States with their parents, undocumented, and then because of a minor infraction, 25, 30 years later, are deported. One of the major consequences of this, among many others, is we're seeing a lot of mental health issues. Many of these young people being deported don't speak the language, are unfamiliar with unfamiliar with kind of the social environment in which they find themselves in, and are relatively socially isolated. So we're seeing some really serious mental health issues with people going back in this process of adaptation to a life which they were not familiar with. For immigrants that have been recent immigrants to the United States, again, we're seeing of the same sort of process, but probably a little bit more acute than in Mexico. We're seeing, again, mental health issues. We're seeing huge disparities as a result of the COVID epidemic, as we're all familiar with. It's impacted the immigrant community more than any other populations. And that continues to be some of the repercussions of this.
Yeah, and I think the previous presentation talked a little bit about the impact of COVID on their research study, and I think for us it was very similar. We're right in the midst of collecting data There was a halt at the height of this in both cities, in both countries. But one of the things we're really, starting to identify are two things. One is that the immigrants or the deportees who are returning to Mexico, we have a disproportionate amount of them who are being deported for nonviolent drug offenses. And again, this speaks to the policy failure of the war on drugs, where we're seeing young men and women who are being deported for, DUIs or having, small personal use of drugs, for instance, like marijuana on them. And number two, here in Los Angeles, we are seeing that there is an increase, for instance, in alcohol use among the population of recent immigrants. But I think our research is currently, like I said, we're less than halfway through this research project, but we're going to be able to document, I think, kind of the trajectory of substance use in terms of patterns of initiation. Did patterns of drug use initiate in the US, or did they initiate in Mexico? We are going to document patterns of increase use, and we're going to see patterns of desistance of drug use and cessation. So I think it's a very exciting time for our research project in terms of having access to this type of population and documenting the drug use patterns amongst the two groups. So there's a message, there's a question regarding what were some of the findings on the gang-affiliated group of women that you followed from age 16 to 30? So I think
I'll let Alice answer that.
Yeah. So I think one of the unique aspects of these two studies, because I just want to clarify that these were two cohorts of young men and women who we have been following up for over 10 years now. We interviewed them as adolescents, the young men who were street gang affiliated, and the young women who were affiliated tangentially, because this is, again, very unique. These were not gang involved women, but they were affiliated with gangs because of their relationships with their male partners as boyfriends, cousins, brothers. And so for the young women who we have been following up for over 15, 20 years, we have seen kind of the cumulative and chronic trauma that many of them have been exposed to. We have approximately an average of 15 plus years of being in a violent intimate partner relationship during the course of their short lifespan. And we have seen also kind of the impact that has had on their physical and mental health status. One of the big findings, however, and this gets back to how we introduced kind of our work, is the fact that these young women, because of for instance, the fact that they use drugs, the fact that they're involved in the criminal justice system, there's a lot of hesitancy of engaging with any kind of institution, i.e. organizations that would potentially provide health services and or services for partner abuse. And much of this has to do with the fact of the negative experiences that they've had with the criminal justice system, with CPS, and the removal of their children from their home. So these are things that we are working on and trying to develop kind of more tailorized interventions for criminally involved women who don't seek out the help and the services related to their victimization of violence and partner relationships. And I think,
Well, for men, one of the primary issues have been because they were quote gang members when they were younger. Many of them ended up being victimized by the criminal justice system with felonies at 17, 18 years old. And the result of these felonies is they were given access to public health, public housing, employment. That sort of cascaded, right? It's unfolded into a kind of a life which they weren't able to escape from, and given kind of these structural factors have resulted in these men, being very very socially isolated from their families, from their children, and destitute, and many of them are at 35 and 40 years old, have very serious health problems, diabetes, high blood pressure, and other kinds of health issues, as well as some mental health issues, problems as well. So there's a really serious consequence, and it's sort of a hidden population. I would almost call them an underclass that we tend to overlook in our when we think of Hispanic populations, especially so.
And we have another question about, how do you recruit immigrants for your research? Are some undocumented people worried about being caught by the authorities, and how do you build trust?
Great question.
That is a great question, and whoever asked it, we'd love to talk to you. So let's just, we're going to be honest here. It has been a challenge. It hasn't been a challenge in Mexico. We were more than halfway through our recruitment. And again, this has to do with the nature of the population, right? People who have returned voluntarily or been deported. But people here, right, as the person who asked this question have a lot to lose. Our research team are currently out on the streets. COVID really threw a wrench into all of this. And I guess pre-COVID, the anti-immigrant sentiment that was occurring with the previous administration also made it really hard for us to identify that population. We're currently using virtual methods because of COVID. We had to create Facebook pages and doing virtual interviews. And so that has been really difficult. Now that the city is starting to open up, we're now back kind of a little bit on track in terms of recruiting this population. But it's all word of mouth. It's building that trust, being in those certain communities day in and day out. And as we tell our research team, it's a matter of presence and visibility, and developing the rapport that is needed for individuals in these particular circumstances to trust us as public health researchers. So it is a challenge, but we're working on that. What new policies do you want to see focused on racial equity in drug policy?
Well, one of the things, the primary thing is the decriminalization of drugs, and I think that we see the impact that the cannabis decriminalization has had on minority populations here in California and in other states. We think that there should be decriminalization of other drugs on a personal use level in any way. We think that would have a major impact on their populations. I think that would be, to me, one of the most important things. I think that we should also develop more of the harm reduction policies that we know work. They work in states in which they've been implemented, such as in Oregon, and we know they work in other countries like in Canada and Portugal, where harm reductions policies have reduced the consequences of drug use. So safe injection sites, needle exchange programs, just to name a couple of the harm reduction policies that I think should be implemented. But I really think that we should move away from dealing with substance use as a criminal issue, right, criminalization, and move it towards more public health view. And I think that you're seeing this in a sort of response to the opiate epidemic in the Northeast, where you're seeing it being approached much more from a public health perspective, and I think that's really kind of where we should be moving towards public policy.
And what have been the biggest challenges you have seen among these populations that contribute to their substance use? Again, we both agree that we really need to move beyond kind of going beyond the individual factors and really start focusing on these macro level sociostructural factors. I think one of the biggest things is that these populations are so marginalized and isolated, and are, really in kind of in a state of despair. Everything from the fact that there has been loss of employment, incarceration has probably one of the biggest impacts, not on the individual, but as the family unit and the community unit. So I think those are definitely some of the biggest challenges of like, how do we go beyond just individual treatment? We need to start talking about, again, what we rarely do, which is how do we do kind of more community-based, place-based interventions? Because, I think context matters. Rarely also do we talk about how drug use, people are using drugs. We're sitting in downtown LA right now, and I could probably bet you that across the street from us, there are individuals using drugs in a safe place in their homes and residences. But when you have individuals who are homeless, when you have individuals who are living in some of these kind of more impoverished communities and neighborhoods, they require themselves to go out, score on the street, use on the street. And so that's where I think the biggest issues occur in terms of, safe haven and context in terms of these populations. So I think those are things we really need to start talking about these types of issues in these kinds of settings and in these kinds of venues. Have another question. How has Latinx culture on mental health and rehabilitation affected your research? How has Latinx culture on mental health and rehab affected your research?
Well, I'm not sure. I'm not really sure that I could answer that question directly. I would just say that when we think of programs, we think of drug interventions or drug prevention strategies to use in Latinx communities. Culture becomes a really important factor that needs to be considered. We know that in these Latino communities, family, is a very important institution. The families are generally very understanding, forgiving of individuals in those families that are possibly abusing substances. And so any kind of a treatment model that we develop, I would say needs to take in, be treated not sort of at the individual, but more at the family level. And, we know that there are some programs that are being developed, for instance, at the University of Miami by Dr. Daniel Santesteban, who has a kind of very effective intervention it's tailored to Latino populations and then tailored to the family situation itself. So I think that's the kind of approach that we should be having. I do not think that like one approach, right, fits everyone, regardless of their ethnicity, their race, or their economic status. It has to be adopted to that particular community. So I think that's a great question, and it's really a challenge for us as researchers to really come up with culturally relevant mental health and rehabilitation programs for these populations.
Mhm. And we have another question about, have you all done any research for populations that are temporary migrant workers, i.e. Mexican fruit workers? That's also a very good question. The focus of the current NIMH study was focused more on urban populations. So floating populations between large urban centers. And so we were not focused on kind of more of the agricultural workers. However, because of COVID, we began to examine the impact COVID has had on essential workers here in Los Angeles. We are working towards putting together, submitting an application to NIH that focuses on essential workers that include a disproportionate population of agricultural workers. And so that's currently something that we're working on, but we have not worked with that population as of today. But we intend to hopefully focus on that. What role has technology played in the health outcomes in the female gang-associated people you have tracked over the past 20 years? So we're running out of time, but I would like to say that for the women, the technology pre-COVID was very, very important in terms of recruitment. So we had to relocate and recruit and re-interview these young women after we hadn't seen them, since they were adolescents. And many of these young women were on Facebook. And so that really helped our recruitment purposes. Now, currently, during this COVID kind of shutdown that we had and the halt in our research, it became a little difficult, especially given the sensitive nature of our research focused on intimate partner violence, to be able to do virtual interviews when the women were at home with family, with partners. And so contrary to what other colleagues of ours have had in terms of the success of doing virtual interviewing, I think we had a much harder time given the sensitive nature of the population. But technology was a big factor in terms of our recruitment purposes. I hope that answered the question, I think.
Yeah, I would just like one last thought. I think that we need to move away from demonizing drug users. We tend to think that using drugs is really the major issue in their lives, and actually, if they're using drugs for a lot of different factors, and I think that those are really the precursors to the substance use. And I think that we need to kind of refocus, reframe our sort of view of drug users and move away from demonizing them. And I think that's kind of the first step for us as a social work profession, and start treating them in a more humane way. Yeah, thank you.
Thank you so much, Dr. Cepeda and Dr. Valdez, for your important research and for speaking with us today. We really appreciate it. That concludes the presentations portion of the Next Generation Social Work Conference. I want to thank all of our guest speakers for their wonderful presentations, and I hope you have learned a bit more about how social work is advancing research and practice in addiction science. Please join us now for our Meet the Schools Fair on the Brazen platform, where you can interact with 23 schools of social work around the country to learn more about their MSW programs. Thank you for joining us.